This is Terms of Reference. Today's guest is Barbara Pierce Bush, daughter of former President George W. Bush and co-founder in 2009 of Global Health Corps, which provides opportunities for young professionals from diverse backgrounds to work on the front lines of the fight for global health equity. Global Health Corps pairs its fellows with organizations that require new thinking and innovative solutions, and works right now in Burundi, Malawi, Rwanda, Uganda, the United States, and Zambia. Terms of Reference's Paige Fetzer spoke with Bush early last year.
I, first off, wanted to just thank you for taking the time to speak to me today. I really appreciate it.
Of course, absolutely.
So, I guess my first question for you was sort of, what was your inspiration for starting the Global Health Corps?
I guess about 4 years ago, I was connected with the guys who I ended up starting Global Health Corps with. Two of them were working at Google, and they still work at Google, and then two of them had been working in an organization called Faces, which was focused on mobilizing college students to mobilize resources focused on HIV. So it was very much kind of a college advocacy organization, and they had chapters across the United States. They have about 110 college chapters. And we ended up being connected about 4 years ago through a UNAIDS conference. And at the time, Peter Piot was running UNAIDS, and he was about to retire. And he has been working on HIV issues since the 80s, since he was a doctor and since the beginning of his career. And I think he sort of tried to gather a lot of younger people interested in global health because he really wanted to make sure that the work that had been done on HIV and then more broadly on global health would be continued, and that people in our generation would step up and kind of continue to move the needle on those issues rather than falling backwards and not focusing on global health. And through that conference, I ended up being connected with these other four guys, and we were all recent college graduates and all were coming from backgrounds very interested in health. I had before that been living in South Africa and Botswana, working in South Africa at a children's hospital called Red Cross Children's Hospital, and then for UNICEF in Botswana. And my career had been very focused on health issues and obviously health outcomes. And when I met my colleagues, we ended up sort of brainstorming around the fact that we felt like there was this huge interest in global health right now on college campuses and sort of with younger leaders, yet it's hard to transition from interest into action and really make a career out of it unless you're a doctor or a nurse and you're on that, med school pathway. And so what we wanted to do was figure out a way that we could harness that energy and interest of our age group to tangibly create health, better health outcomes. And the way that we chose to do that was through a fellowship program, really trying to highlight the fact that so many different skill sets are needed to make change in global health. And while there is definitely a role for doctors and nurses, there's also a role for people with business backgrounds and communications backgrounds and bringing other skill sets to the table so that solutions might be different.
Yeah, I've been like I said, I was reading the blogs of your fellows, and it seems like a diverse group, but they're all just doing amazing things. And so the next question, I was hoping to get one of your memorable stories from sort of working in the field along the lines of your organization.
I think what's been amazing, and as you just sort of pointed out, is that our fellows do come from, really different backgrounds, and from, this year they're from 12 countries. And what's been exciting for us is to see how bringing, fellows with very different skill sets to the table can create new solutions. And when we started, as I think all of our fellows, we are modeled solely based on partnerships. So we partner with other organizations that are doing great work in health and then place our fellows within those orgs so that we aren't necessarily reinventing programming on the ground, but we're figuring out who's doing great work, and then we're doing the leadership development piece with our fellows so that they can, be change makers in this field throughout their careers. But I think what's been really interesting and amazing to see is the impact that fellows with different skill sets can have. And so, for instance, we've had 6 fellows that are architects, and none of whom ever thought that they would be working in the global health field when they were in architecture school, but what they've been doing is working with partners in health in Rwanda and the Ministry of Health and an organization called NAS, and they're basically redesigning the way that health clinics and hospitals are built so that there are small changes in airflow, and then therefore infectious diseases like TB don't spread. And so I think it's just one example, but what's been amazing is to see how by bringing people by bringing skill sets that typically aren't at the table in global health, you can see health outcomes change pretty quickly. And that is just one example that I think all of our fellows are excited about because it opens their mind to think about sort of different partnerships and different people that they should be trying to work with and connect with so that there can be more of a paradigm shift in the way that we deliver healthcare.
So do you have any personal stories, like when you first got into international development and health issues, do you have any personal stories that you remember? I don't know, any memorable moments?
Yeah, so I think that's such a hard question because there's like a million memories and stories. And I just got back 2 days ago from being with our fellows in Rwanda and Zambia, and it's, as you were just kind of saying, it's, whenever I'm with them and I see the work that they're doing, it's constantly inspiring and constantly a reminder of, how you can make change on these issues. I think for me, when I initially got interested in global health, I was in college and PEPFAR was being launched, and I happened to have, it was being launched over the summer, and I happened to be on summer break from college, and my job wasn't starting for a few weeks, so I ended up traveling throughout East and Southern Africa just for the launching of PEPFAR, and it was, I think my memories from that very much shaped why I ended up wanting to work in the health field, and it was just so, before that, obviously, if you were living in a developing country and you were HIV positive, you really didn't have a future. AIDS was a death sentence, and it was because medication was so expensive and because there weren't systems that were built to distribute antiretrovirals to, people living in rural areas. And so when I went for PEPFAR, just thinking of images, it very much blew my mind because there were literally thousands of people waiting at health clinics and in the street to get access to the medicine that they needed to have a different future. And I think just seeing how, talking with people who didn't know if they were going to live or not, but realized if they could get access to the medication they needed, it could be a possibility. And, I would talk then with mothers who were bringing their kids with them to health clinics who obviously the kids were so sick and the mothers were just so desperate to make sure that their kids could have access because it meant that their kid would actually grow up. And I think those conversations and those memories, really cemented in my mind why the fact that we know how to do so much in global health, it's just a matter of really doing it. It's amazing that we know how, obviously that example is very HIV focused, but it's amazing that we had treatment and that science had figured out how to create products to save people's lives, and then, we just needed to do more to build the systems that could do so. And I think that trip, and obviously speaking with so many people there that didn't have access to medicine just by default of where they had been born, cemented in my mind that I definitely wanted to work on these issues.
Wow. That does sound very impactful, a very impactful experience. Now that you've been working in international development, since, this first experience to now, I guess in what way has it sort of changed you or taught you? Since I feel like it's a continually, like you continue to learn throughout the whole time you're working abroad like that.
Yeah, absolutely. I think, as you know, the more you work on these issues, the more you realize how much you can learn about them. And I think the main, what we do at Global Health Corps is invest in people, and our product is, people. It's our fellows. It's investing in talent. And I think what is sort of constantly inspiring is seeing our fellows that we have and their passion for these issues and the fact that they're working on obviously huge issues but don't see roadblocks. They see, they have sort of a vision in their mind of what development could look like and could be and how it could change. And I think that is, realizing, trying to create partnerships with sort of people that I never otherwise would have come into contact with. And, in terms of the fact that now I've worked with 216 of our fellows who I otherwise never would have met. And the power that type of community working together can have. Now, and also if you think about in the future, as our fellows and alums end up in bigger positions where they have a bigger influence and they have a bigger voice, they will then have a network to work together with to change the way that healthcare is delivered. And obviously partnership is so critical to accelerate change. And I think that's what has been definitely the biggest lesson for us is, consistently try to reach across borders and reach across sectors and reach across organizations to create partnerships to reach the end goal more quickly.
Absolutely. Okay, and I don't want to take up too much of your time, but I had one more question. What advice would you give to someone who's considering working in international development as a career, or somebody who started out as doing, humanitarian work as a career?
It's critical to learn as much as, the more you work on these issues, the more you realize how much you don't know. And it's critical to, obviously, if you're doing this work, you're trying to be of service. And so learning as much about the communities and the people that you're trying to serve and listening to them rather than thinking that you know what the answer is going to be, I think is so critical and broadly in development, and sort of making sure that what you're doing is relevant, obviously, to the people that you're trying to serve. And so I'd say, my biggest piece of advice is just having that constant curiosity and listening constantly in any community where you're trying to work. And then, not to be so repetitive, but I'd say, trying to think of it as always making sure that you're always looking for partners in this work, because it is hard work, and these issues are really big, and it can be constantly reinvigorating if you're working on these issues with others that are equally as committed to them.
Thank you so much for speaking with me. That was sort of all of my questions.
Awesome. Thanks. Well, thanks so much. We're super excited.
Thank you. Take care.
Thanks. Bye.
Hello?
You've been listening to Terms of Reference, a weekly podcast from apreneur.com. Find us at iTunes and at www.apreneur.com. Thanks for listening, and we'll catch you next time.